Hello everyone, this is Squad 7. My name is Nadia and these are my teammates Crystal, Zahid and Pranav, whose expertise and effort has led to the successful development of this project. Shout out to you guys. For this hackathon, we chose to work with the challenge of developing a technology solution like a mobile app software to increase the accuracy and speed with which early testing can occur. Before we dive into our application, let us look into the problem in hand. The problem scenario is seen in Bangladesh, which is one of the most densely populated countries in the world. Due to the sudden crisis created by coronavirus, the government and hospitals are not efficiently providing citizens with information about where and how to get tested. More exposure events will occur if the patients are wandering around looking to be tested and treated. More patients will die if this problem continues, who could have been saved had they been treated sooner. The solution, you ask, is our web application, Test to Track. It uses a simple interface that tells users the government-designated hospitals to be tested and treated, provides information about hospital availability. It minimizes the hassle patients face in unnecessary movement from hospital to hospital. This saves the crucial time emergency patients do not have the privilege to spare. It also screens out cases that do not need testing, easing the strain on systems. Now we will look at our business model. This is our lean canvas. Our unique value is that we streamline patients for better management, thereby preventing catastrophic outcomes. We have an unfair advantage. The current government site does not have an up-to-date list of screening centers and hospitals that is easily accessible on the web, so people struggle in acquiring the information. This is a solution requested by Bangladeshi doctors in hospitals who are at the forefront of the problem and have identified what they need. Our customer segments include the government willing to improve the coordination between citizens and healthcare system, and profit testing companies looking to fill the gap that this situation has created. The key measures of assessing the success of our app is by taking into account the number of users, the user feedback, and customer feedback. We are planning to promote the web app via other websites, social media, and word of mouth. Our research left us with the following cost structure, which includes hosting, requiring a budget of $100 a month for data storage in a margin, to developers who would be paid $8,000 a month, or Bangladeshi developers who would be paid $2,000 a month. Our revenue model includes using software as a service, and the business-to-business approach of it makes it free for public upfront, plus paid subscriptions for government or private testing companies that use automated testing and tracking. Our research has led to the following data to be collected. The 5 doctors we reached out to unanimously agreed in the mismanagement of patients. At least 2 emergency COVID-19 patients had died as they were referred to a different hospital due to saturated bed occupancy at the first hospital they visited. Multiple posts were made by citizens on the Facebook where they expressed the lack of knowledge about the designated hospitals to get tested and treated. One said, and I quote, "The government needs to step up in spreading the news to reach more people." Citizens also complained of the time delay in screening procedures. The impact we want to create in the community is simple. We are aiming to prevent deaths, to decrease the number of exposure events, to improve the medical outcomes, and therefore avoiding civil unrest. We don't have the proper knowledge to sharpen our vision for the project, so we are seeking for your mentorship. We want your guidance on setting up the cost structure and revenue streams. We need advice on the security issues, backend, and Google API. We would also need help in negotiating effectively with the government and information on data privacy and sovereignty laws. Thank you, everyone.